Hi everyone. Let's talk a little bit about medical liability. What is medical liability? Well, it's when a healthcare provider causes injury or death to a patient through a negligent act or by omission of providing some type of service. Quality improvement and patient safety risk management programs help definitely in limiting the amount or the number of potential litigations against a healthcare facility. So it's really, really important to begin, if you don't have one, to looking at developing these types of programs: quality improvement, patient safety / risk reduction. One of the key elements in the Centers for Medicare and Medicaid Services, otherwise known as the CMS, is that hospitals are actually going to be paid by them a bonus, or money is going to be taken away from them based on the quality of care they deliver. So hospital administrators need to be aware of how they're going to provide the best coordinated care for the patients that they see. And in healthcare facilities, a role known as the case manager has become critical and basically is known as the face of the hospital, where these managers play an essential role, and they're almost a critical role that the facilities cannot do without. These clinicians are responsible for ensuring that patient care is delivered appropriately to every patient and that the hospital gets reimbursed for that care. Only case managers are responsible for both of these essential functions, and you can see how important cost is and quality to the survival of any healthcare facility. So again, as a result of the case manager role, they're making considerable contributions to the bottom line of hospitals and healthcare systems. How do they do this? There are 5 ways that case managers help improve hospital performance. First is improving outcomes. They have a pulse on each and every patient, so they're looking at reducing readmissions by providing the best or having the best care delivered to the patients, improving their outcomes before they leave the actual hospital. In times of economic crisis and whatnot, the coordination of services is really important. And it is anyway, I shouldn't just say an economic crisis. And it can help. So it can help in improving outcomes by a case manager looking at what the patient is doing and experiencing while he or she is in the hospital itself. The second piece is in looking at reducing readmissions. And the Centers for Medicare and Medicaid are really interested in reducing readmissions to the hospital. Many times patients are discharged either too soon or not with the appropriate referrals in the outpatient arena, and they end up coming back into the hospital. And this is a big, big piece that the case managers can play an important role in, because they can actually coordinate those gaps, making appointments and whatnot to avoid unnecessary readmissions to a healthcare facility. Another thing that they can do is help eliminate avoidable days in the hospital. Medicare is not, and Medicaid, going to be paying for patients to stay longer than is determined medically necessary. So therefore, it again falls on the case manager to look at making arrangements and planning a patient's discharge either to a long-term care facility, a rehab facility, or whatever the case is. So again, case managers are really critical to that role of eliminating unavoidable days. The case manager, for a fourth way of helping hospitals, is to enhance claims management. Again, they ensure that the patient hospital stay or any part of that stay is medically necessary. If it's not medically necessary, they may not be reimbursed. Hospitals are acute care, not custodial care. So again, you can lose thousands and thousands of dollars if the patient does not belong in that facility. It is up to the case manager to speak with the patients and or their family members, advocate for the patient if it's appropriate, and make the necessary arrangements. The fifth and last piece is boosting core competencies under the Patient Protection and Affordable Care Act, ensuring that patient has insurance coverage for every day that they're in the hospital as being a major part of the case manager's function. The boosting of core competencies refers to bonus payments or takeaways, as I had mentioned earlier, and that CMS or the Centers for Medicare and Medicaid base their criteria on, they base these bonuses and penalties on established criteria, so that they're really looking at the patient experience, the quality of care that was rendered, and any readmission notes and rates that may be in existence. Healthcare organizations are required under this act to improve or launch preventative care initiatives among covered populations, and the care programs are designed for at-risk populations who have costly chronic illnesses such as asthma, heart disease, diabetes, depression, pulmonary diseases of all sorts. So again, these conditions are costly, and case managers can help with regard to planning appropriate initiatives for the patient to receive the follow-up care that they need and whatnot, and to help with providing a better quality of life to them. Hospital and healthcare systems in particular are beginning to realize the economic consequences of this Patient Protection and Affordable Care Act, and recognize that if there was ever a time to have or time to use the expertise, skills, and knowledge of a proven workforce such as a case manager to enhance their processes, and bottom line, that the time is now. Just to talk a little bit about the CMS Quality Payment Program, what that is it improves Medicare by helping one focus on quality care and the one thing that matters most, making patients healthier. May not be able to cure every single patient, but to help bring them up to the highest level of functioning. The Medicare Access and CHIP Reauthorization Act of 2015 ended the sustainable growth rate formula, which threatened clinicians participating in Medicare with potential payment cliffs for 13 years. If your facility participates in Medicare Part B, you are part of the team of clinicians who serve more than 55 million of the country's most vulnerable people. And the Quality Payment Program will help provide new tools and resources that can give your patients the best possible care. There's ways for practices, and these are mostly for physician practices, on how to choose which tracks for reimbursement. One is the Advanced Alternative Payment model, and the second is the Merit-Based Incentive Payment System, or MIPS, M-I-P-S, and the Advanced Alternative Payment model is APMs. If you decide to participate in the advanced through Medicare Part B, you can earn an incentive payment for participating in the innovative payment model. If you decide to participate in the MIPS, you earn a performance-based payment adjustment. So it behooves the managers of large office practices, small office practices, and whatnot, to begin to familiarize yourself with these new payment systems. If you look at it, it can begin as of January 1st, 2017. So it's already in there, and data has to be collected, performance data, so that you can you can show your performance data and prove what you're doing. There's a lot that can be read on the Medicare, Medicaid, or the CMS site to go into more detail if you're interested. But right now, that's about it. I just wanted to share those payment programs briefly and let you know that they're out there. Thank you.